Okay, well, welcome everyone to the August PFCC Partners Workshop. I am so thrilled to see so many wonderful names participating in today's workshop, and very excited for Libby Hoy, founder and CEO of PFCC Partners, to talk a little bit about the PFA network and our mission to really build a national advisory effort with the help of all of the advisors on the call today. Very excited to hear more from Libby about that and discover more ways that all of you can get connected as well. Go to the next slide.
Oh, right.
You got it. You're driving. Oh, I guess I can turn my camera on so you guys can see me too. Hello. And so just a reminder for all of you joining today's Zoom meeting, if you do have some background noise, please go ahead and mute your lines. We will have some opportunities for discussions later on in today's workshop. If I do hear some of you and I can see who has some of that background noise, I might go ahead and mute yourself. So you might get an update that I have muted you. And if you would like to share your video, please do so. I was reminded to do that as well. You should see the screen in front of you. If you have any questions throughout the workshop, you can click raise hand by going to manage participants and finding raise hand. And then I can go ahead and nudge Libby with a question. You can also use the chat box. I've put in a question in there. It would be so great for all of you who are on the computer to please quickly introduce yourself, where you're from, and maybe a little bit of information about your interest in the PFA network. That would be great. Okay, next slide. All right, and so for those of you who are new to PFCC Partners, this is our vision here on the screen. We really recognize that the quality of healthcare outcomes is improved when the expertise of the healthcare provider is partnered with the experience of the patient and family. And I'm really excited to have both those healthcare providers, advisory council facilitators, and patient and family advisors on today's workshop with us. So thank you all for joining. And really, patient-family centered care is all about partnering to co-design those policies and programs and individual care plans for the best outcomes possible. Next slide. So before I pass it off to Libby, I just wanted to remind everyone of a few upcoming PFCC Partners events. The first being the PFA Network virtual meeting, and you'll learn more about what that entails in today's workshop. But our next one will be September 13th at noon Pacific Standard Time. And then finally, a month from now, we have our September workshop, where we will have Ray Ryback from Pomona Valley Hospital Medical Center. She will be talking about improving patient care with advisor committee participation. So if you are an advisor and would like to join that to hear more about how you can participate on committees, or facilitators who are looking to involve their advisors on committees, this will be a really great workshop for all of you to attend, and that will be September 22nd at noon Pacific Standard Time. And really quickly, I just wanted to shout this out, a quick save the date. We have a date for our next PFCC conference in Los Angeles. It will be on March 12th of, oh, not this year, next year.
Oops.
Oops, March 12th of 2018. And we will have a request for proposals coming soon, but I just wanted to let all of you know that we have a date. And so if you want to start planning, go ahead. And I think with that, I'll go ahead and pass it off to Libby Hoy.
Good afternoon, everybody, and thanks so much for taking an hour out of your busy schedules to join us for this workshop today. I really appreciate the opportunity to share with you how excited we all are at the expansion of the Patient Family Advisor Network, and to share some of the things going on, to invite you to participate in the PFAN network, and to request you co-design the network itself with us so that we are truly designing a community of advisors for advisors. So I'll start with introducing our tiny but mighty team, as I refer to it. Libby Hoy. Stephen Hoy, we also have on the line. He's our Chief Operating Officer. Lindsay, you've been hearing from, our Director of Education. Nicole Fort, who has a wonderful schedule and gets her summers off, will be rejoining us next week. Not pictured here is Kelsey Skelly, who has filled in for Nicole and actually has created herself a job managing our social media, so she'll be staying on with us. So anybody out there who's questioning the work capacity of millennials, think again. And finally, Erica Steed, who I think we've introduced on this workshop call before. Erica's pivotal to our conversation today as she's really taking the lead on expanding the Patient Family Advisor Network. All right. Lindsay, I'm going to ask you to interrupt me if anyone raises their hand and or has any chat questions. So
I will do that.
Thank you, because I have proven time and again that I can't read and speak at the same time.
It's hard.
All right, so the history of the PFAN network, we actually started it in 2013 with no resources whatsoever, but really came out of the conversation at the IHI Forum. Institute for Healthcare Improvement convened a number of advisors at their national forum they started in 2010 and grew in that effort. And the advisors, we kind of all got together at the forum, but thought, God, we should be connecting in between time and really sharing what we're learning and sharing what contributions we're making to healthcare. And so that's really where we started, and we kind of slugged along for a number of years before deciding that we really needed to contribute to this field, really needed to contribute to the development of the community of patient family advisors. So part of that motivation to expand came from our work with healthcare organizations. So over the last 3 years, we've started just about 100 different patient family advisory councils across healthcare settings. And so if you kind of assume that each of those councils maybe starts around 10 new advisors, that's 1,000 new people that are working in this field. And so we saw a need for us to connect, for more experienced advisors to be able to mentor, and that's what really got us excited about expanding the Patient Family Advisor Network, just that need to contribute to the community. So our mission for the PFA network is to create a network of thoughtful and prepared patient family advisors grounded in authentic partnership approach. That's really our approach to co-design policies, research, and care delivery. This mission was taken to our Patient Family Advisor Network, so it really is got the sort of stamp of approval from that group. We do that through our virtual meetings, which I'll talk about in just a moment. You'll see a nice white space right here. Wouldn't it look nice if it had a logo? We're working on a logo specific to the Patient Family Advisor Network. So for now, we'll look at some pretty clean white space, but very soon in the near future, we'll have a logo distinct from PFCCparnters for the Advisor Network. So this is the definition that kind of is that throwback to the IHI group. We had 25 advisors in the room that really had a discussion about what it is we do as advisors in 2012, and how do we partner with our hospitals and our ambulatory centers and our psychiatric facilities and research. And this is really what we came up with. I think one of the distinctions that I wanted to point out on this slide is it's been very beneficial in our experience to share this definition with both facilitators, for those of you working to coordinate patient family advisors, as well as for advisors themselves, because before that it was sort of this nebulous term and nebulous idea of what could occur. This was, you know, again, written by advisors for advisors to give us sort of an idea of what that possibly can look like. This is, 2017, we're going into 2018. I think we need to relook at this because times have changed in those 5 years, and we've had a number of new and expanding opportunities for advisors to get involved. So this is something on our radar, and these are the kinds of things that, as a group, the Patient Family Advisor Network will continue to look at. Lindsay, I'm getting a little bit of noise. I don't know if you can isolate that person. Thank you.
Yeah, I'm trying.
All right, thanks.
And just a quick reminder to everyone to please mute your lines because we are having a lot of background noise.
Thank you. Please feel free to share this with your own advisors, or if you are an advisor, really take a look at it and let us know where you think we can add to it or what may no longer be relevant. All right. So I think semantics are really important, and getting everybody on the same page with what we're referring to in terms of a patient family advisor is important in terms of orienting all of us to the same spot for the PFAN. So we use the term patient family advisor. I hear lots of terms around patient family partners, patient family experts, patient family advocates, patient family research partners, or team members. And I think that all of these terms have great value. I am not here to tell you that one is better than another. I will tell you that the term we're using isn't even my favorite in this in this capacity, but this is what we started with. And so the way that we're looking at the term patient family advisor is very broad and inclusive of all of those. The essential element of partnership is really the founding contribution. So no matter what you call yourselves, or no matter what you call your patient and family, person and family, community member, beneficiary, whatever you call your partners, if they're partnering with you to improve or address a research concern, but if that relationship is based in partnership, they would find value in the Patient Family Advisor Network. Hopefully that makes sense. I'm going to further delineate the term advocate because I think it's really important to our work, and it took me a long time to sort of understand and get straight how that works, how the two work together. So you might see in the definition the word advocate. So as advisors, we start from a partnership base. As part of that, we may advocate on behalf of all of the patients and families served. We take that representative voice. Advocates raise our awareness and consciousness of important issues. I look to our patient safety advocates who really laid the groundwork so that we could come in as partners. And so with an advocate, there's sort of an end in mind, right? We want to raise awareness about sepsis. So our patient safety advocates really focus on sepsis and focus on the problem, focus on the incidence rates and those sort of things. So the advocate has an endpoint in mind. The advisor comes in as a partner to co-design the improvement, to co-design the solution. So we come in without an outcome in mind. Rather, we come in as a partner to, again, co-design the solution for what we're looking for. So that's the way that we at PFCC Partners and the PFAN Network are looking at these terms. And I just thought it was important for you to, as you get involved in the PFAN, have a good understanding of sort of how we're looking at all these terms. Again, not professing to have it all right or be the end all and be all, but this is how we're defining it. So moving on then, what is the purpose of having a sense of community? What was the ask by those advisors back in 2012 at IHI? It was to create the sense of community around the role of advisor, to bring together advisors so they could learn from one another, so that we could have mentors and mentees, so that we could share best practices in terms of how do you meaningfully participate on a lean team, to spread ideas. So if we've got one group from Sutter Health working on a readmissions program, how can the people at Bay State borrow that and grow from it? So building a platform, if you will, or a community has been a driving purpose. The second area is skills exchange. We wanted to provide, again, an opportunity for us to share our skills, to develop our capacity, to build on the effectiveness and the impact that advisors can have within their own partnership roles. And then finally, we wanted to be able to connect people. I often refer to myself as a giant Lego, and I think that's, in a lot of ways, my biggest contribution to the field is just connecting. Oh, you need someone over here let me grab a advisor for you, or how can we help? So those engagement opportunities is the final kind of purpose that we have moving forward. So I'm going to start with kind of what the activities that we are currently involved in each of these areas, and of course open to suggestions from healthcare staff members who are facilitating advisory groups, to advisors themselves, to really help us grow this community and help us know where you need us to focus, what you might need from us next. So to start off our community, we have monthly virtual meetings, the second Wednesday of every month at noon Pacific Standard Time. And the Zoom login information is available on the website, which I'll show you in just a minute. The virtual meetings are an opportunity for us to, again, build that sense of community, provide some skills awareness. We often go through the core competencies, or one or two of the competencies of effective advisors on those calls. And then we also offer engagement opportunities. The kind of cool thing lately that's been happening is folks want to come to this group of advisors and share their programs and get feedback from an advisory group on larger programs. So, and it rolled really nicely into another request that we had from advisors, and that was, boy, there's a list at IPFCC, and there's a list at Barrel, and you guys got this list, and so how do they all work together, and would you please coordinate and not have us be pulled apart? We have coordinated. We have had great conversations with Bev Johnson at IPFCC. I just had coffee with her this morning, which started my day off right. And then we've had conversations with Jason at Barrel, and I'm really pleased to say that we're working collaboratively to ensure that each of our lists are kind of helping in a different way. So it's not a either or, it's an and. Take advantage of what makes sense to you in your role as advisor at the timing you need. The last virtual meeting, we had Marie Abraham from the IPFCC join us because she's working on a very important pre-admission checklist for our hospitals that are involved in CMS's Partnership for Patient project. And so in the development of this checklist, Marie was able to bring it to our virtual meeting and have the advisors on the call give her some feedback about what really helped them to establish that engagement during the hospitalization, which is the point of the pre-admission checklist. So great collaborations going on, but these are the kinds of things we talk about on those virtual meetings. We work really hard, although sometimes we get impacted. We work really hard to make sure that there's open space for the advisors on the call to share what they're working on, ask questions of the group, really connect with the network. The website, you know what, I said I was going to switch over to the website, but I'm checking. I'm not going to even try it because I've got things working right now and I just don't want to mess with the technology gods. So the website, again, we just developed the website. It's still in development. Please give us your feedback. Tell us what works, what's broken, what you see. But this is going to be our primary site going forward for advisors to sort of connect. You'll see that it reflects those three areas of community skills exchange and engagement. Join the PFAN network here. That will connect you rather to a detailed survey that is helping us to build a registry of advisors, which I'll talk about a little bit more further into the conversation. But the more advisors the more information we have about the advisors in the network, the better connections we can make for the advisors and for the organizations that are looking to us to make those connections. So I encourage you to take a look at the website, give us some feedback, but as well take a look at the opportunities there to get involved. The newsletter is another way that we're building community and network. Erica and I had a wonderful call with Patty Webster from IHI, who's an expert at building networks. And so we're trying to really get the idea of providing many different routes for folks to get involved. And so the newsletter is another route that we're using. The newsletter also reflects the website in that it has our calls to action. So through the skills exchange and the work groups that you'll hear about, we've generated some calls to action where we want advisors to get involved and take items back to their own organizations and then let us know how that goes. So that's available in the newsletters as well. And then again, of course, the engagement opportunities. Lastly, but very importantly, we have a wonderful collaboration with the Smart Patients community. And I'm not sure if any of you are familiar with Smart Patients, but it is a peer support platform for folks encountering chronic illness. So they have disease-specific communities to offer online peer support in a number of different ways. What I think is exceptionally cool about the Smart Patients platform is they have the ability to cross-disease specific platforms. So for instance, if you're seeking support about maybe supporting your supporting your spouse through a chronic illness, that idea cuts across no matter what disease you're working on. And so their platform has that ability to connect people even laterally across disease groups, in addition to providing the disease-specific support. So what they found is they started to have these advisors popping up that were in a number of different areas. They also have a subgroups for specific hospitals. And so a lot of the hospitals were bringing in their advisory groups. And so the advisors wanted a method to connect. So they gave us a call and we were able to work out how we could host the PFAN networks on their virtual community. And so that's what we've done. And again, we'd invite you to go to Smart Patients and join the virtual community as well. And then thanks to Kelsey's help, because the rest of us are too old to understand Facebook and Twitter completely, Kelsey has us up and running on both, and so we would invite you to follow us on those mediums to get regular announcements about our activities. All right, so moving into the engagement opportunities. This has been an area that's been, wow, over the last 3 to 6 months has really expanded. So we're getting contacts where I think we maybe got, 1 or 2 a month 6 months ago. We're getting half a dozen a week now to ask, do you have an advisor who could speak to this? Do you have an advisor who might want to participate in this research team? Do you have an advisor who would participate in this webinar? It's been an incredible uptake, and I think because we have this resource of advisors, it really helps us to help others spread the impact of advisors across all healthcare settings. So we have we've kind of delineated those requests, those engagement requests, into sort of the all calls. So those would be somebody calling up and saying, we've got this conference coming up and we're opening it to advisors free of charge. Do you have anybody who'd be interested? And so we put that out in the newsletter. We'll put it on the website. We'll just make like a broad broadcast. And then we get folks that call and say, we need someone to work on this technical expert panel. Would you be able to recruit someone with this particular experience? And then would you then be able to prepare them for onboarding onto that technical expert panel and potentially facilitate that onboarding? So that's a deeper ask, and it requires more of our staff time to make a good match and find this is where the registry is helping us so much. It's really exciting. But that we often will charge a fee for that. And the reason we do that, number one, is it helps support the PFAN network because PFCC Partners is sponsoring the network in its entirety. So every little bit helps us to keep the network going. And the other piece of that is if we are collecting a fee, we are passing that on to the advisor we're recruiting. So they are getting a stipend for that work, which we want to contribute when advisors are working beyond their advisory council and that once a month kind of site-specific local work. When they're coming up and doing national webinars and meetings and working on technical expert panels, those sorts of things, we know that some stipend is appropriate for that. So those are sort of the two ways that we're working. These are some of the folks, just since we started tracking, which has only been since June, about mid-June, we decided, hey, we should probably keep track of this. We've recruited 28 advisors to specific projects. These are some of the partners that we've had. Partnership for Patients. We recruited an advisor and prepared her to participate in their National Patient Family Engagement Affinity Call. We have a great collaboration with Open Notes. I'm really excited that Joan Maxwell, one of our advisors from the PFAN, who works with John Muir up in Northern California, just yesterday was accepted on our nomination for the National Quality Forum's work team on the opioid crisis. So helping, provide that nomination. Patient Priorities Care, we just had a great meeting with about 10 advisors in New York that interacted with surgeons and researchers and primary care physicians and funders to talk together and problem solve, co-design what's the next steps in patient priority care. Quality Insights, sorry, that's a little bit dark. I was stealing their logo from their website and they didn't like that. Or it didn't like that. Quality Insights, we're doing a number of technical expert panels and supplying them with prepared advisors for those important panels. The Barrel Institute, we've recruited a couple of advisors for some of their work, a white paper and a grand rounds they have coming up. And then the group at the bottom is one of the practice transformation networks here in California for the Transforming Clinical Practice Initiatives, which is targeting ambulatory care. And we were able to partner with them to create 2 patient family advisory panels, which we facilitated at their conferences. So getting the ambulatory centers kind of comfortable and providing ambulatory staff the opportunity to talk with advisors and see what that might look like in their environments. So these are just a few. Again, we've only been tracking since June. We have recruited 28 advisors. We've been able to provide stipends to 8 of those. And so we're excited to see where that growth is going. So moving on to the skills exchange piece, it's really about building capacity in the community overall, in our understanding of what the work of the patient family advisors are, and just kind of creating that as a role in the healthcare environment that has core competencies around it, it has a definition around it, and then looking forward to what else do we need to add to that role. So we're really looking to build capacity in each other, build capacity in our advisory councils by sharing from what Hospital A did to what Ambulatory Center C did to what the Neuropsychiatric Hospital D did, and how we can share those programs across. We want to increase advisors' shared knowledge of the PFE environment overall. So how does what I'm doing here or what Stephen's working on at Mammoth Hospital in the Sierras of California, how does that tie into what the National Academy of Medicine is doing or what National Quality Forum is doing? Why does that matter to us, and how do those things connect? So that's an important piece of that skills building is the recognition and bringing together of, frankly, both pieces. And that's what we've worked to do through the Patient Family Advisor Summit, which was an opportunity to bring together our national partners with a room full of advisors that are working on the front lines and having them inform one another's work. I think that's a really important piece, because still when I'm going and visiting advisory councils in our local communities, and I'm talking about the National Academy of Medicine and the Institute of Healthcare Improvement and Center for Medicaid Medicare Services, there's still little understanding. And so we need to increase those connections so that we're sure we're all working on this at the local level, but in line with where we're going nationally as well. And then finally, building the capacity to co-design, to come to all of our partnerships with these core competencies that you see in the triangle there. Those core competencies of effective advisors were generated in the Patient Family Advisor Network. So again, for advisors by advisors. We did a series of surveys and interviews to talk with advisors who were working in the environment, and asking, what are the skills that you use most often in this partnership when you feel like you're being the most effective? And what they came up with was, at the bottom level, you have to have an ability to establish partnerships with the team, with your healthcare team, or the team of that's working at your healthcare or your organization. That's a little bit different than me in my patient role. Most of us in our patient role are kind of looking for that invitation, if you will, in the environment, that I can engage in my care, that I can inform my care planning. All right, not all of us are waiting for an invitation, but by and large, we're still looking to create space in that relationship for patients and families to inform their care. In the role of advisor, we're now looking to be initiators of those partnerships and establishing ourselves as a partner, bringing ourselves into that relationship as, hey, I'm another resource for us to try to figure this out. I'm a strategy for getting us there. So really articulating that very clearly, we find breaks down any concerns or hesitancy on the part of the staff members you're partnering with. So we want our advisors to be able to initiate those partnerships. We want our advisors to be constructively collaborative. So, looking at what's possible, focusing on strengths. How do we move the strengths of the organization to fill the gaps, fill the needs? So we want to be very constructive in our approach. Nobody wants to sit meeting after meeting with folks that are consistently pointing out the problems. That's where we really want to have a solution-focused perspective when we're entering those partnerships again, so that we're looking to where we're headed. There's that great analogy of Wayne Gretzky, that good hockey players go to the puck and great hockey players go to the space. We want our advisors moving to space. We want them to move into what's possible there. I've told this story many times, that I was working with an advisory council years ago, and we had this one advisor who was fantastic. She would show up every month. She would volunteer for every committee and just was all in. Unfortunately, her solution to everything from parking to cold food to reducing infection rates was getting rid of the social work department. She was a little bit stuck, so we found another role for her. So being solution focused is a critical competency for effective advisors. Taking representative voice. This is a big piece of moving from my patient experience into the role of advisor. So I always make Lindsay jump when we get to this part of the skills exchange piece and say, definitively, we're moving over here into the advisor role. Our experiences as patients inform our role as advisor, but the role of advisor is not our patient role. And so how can we use our experiences to illuminate the gaps and illuminate the strengths within a certain organization? That's really important. Recognizing that I'm an N of one. So my experience at my hospital or my healthcare provider is but one. What do I need to do? What do I need to learn as an advisor about how others are experiencing our organization? And I think that's really very, it's the part of the job that I consider most important, that I consider my biggest responsibility. It's not so that, you know, you all know I started as an advisor too long ago to remember, but that's my responsibility, is to open space for every patient, every family member to have voice in the system. It's not about my voice. And so that's an important competency as well. And then finally, teachable spirit, which we got from a lovely man named Kai, who attended one of our skills exchange and sat back very quietly the whole afternoon and then said quietly, you know, this is all about all of us entering this work with a teachable spirit, understanding that there's a lot I don't know about running a healthcare organization, just as there may be some things they don't know about being a patient in that healthcare organization. So these are the foundations for our skills exchange and development. So the work groups are another opportunity for us to exchange skills, to expand our understanding and awareness of what's sort of going on out there. The work groups were generated at the 2016 Patient Family Advisors Summit. As I alluded to before, that was our second summit, and the summit was an opportunity to bring together, you know, around 50 advisors together with national partners from CMS, the Institute of Medicine or National Academy of Medicine, from the Institute of Healthcare Improvement, the American College of Physicians, the National Coordinating Center for QIOs, lots of folks that are really writing policy and moving patient-family engagement forward, and whom it would be really important to hear from the frontline advisors in terms of what that work looks like as they're writing policy. And at the same time, for our advisors in the room to understand how these national partners are supporting the work that they're doing at a local level and how they might draw down resources and support from these organizations. So the first summit that we had phenomenal discussion, great facilitated discussion, got a lot of great ideas, and then we did nothing with them. So we learned, and the second summit, we ended the day with an ask or a charge for the participants to identify the top priorities where we really felt we could have a positive impact as a group. Our theme for that day was, what can we do together today? And so taking that theme forward, we wanted to know what were the ideals about the priorities that we really felt like we could have impact. So we launched those in 2017. We launched 5. We've since combined 2. So we have 3 work groups going right now. Those work groups started with an environmental scan. We didn't want to duplicate any other of the great work going on out there. We wanted to look for space, look for a gap and be able to fill that. From the environmental scan on each of these topic areas, which I'll get to in just a second, we narrowed down a more focused effort. That happened, I would say, anywhere from March to May. And so in these ensuing months, we've been working hard in these groups to move these items forward. So the first area of focus that folks from the summit wanted to look at was patient access. And Erica had a great question yesterday. She was asking me, do you mean patient access in terms of being able to get in to see a specialist, those sorts of things, or do you mean access to records? The conversation in the room was quite large. But again, we needed a focus, and because these are small work groups, and we wanted to be very targeted in our approach. And so we looked at how could we increase patient access to their records. Uh-oh. Am I still? Oh, no, good. Okay. So the goal there then is for this work group is to mobilize patient family advisors themselves and the advisory councils to increase the adoption and implementation of open notes to increase access to patient records. If you don't know about open notes, I strongly suggest you go on to learn more about this. It's not an initiative, it's a movement. So this movement towards patients having full access to their notes. We've joined with the Open Notes team to think about broad ways that we can support the adoption and implementation. So what we've learned from them and learned from the advisors we've talked with is that organizations who adopt Open Notes often do so and are very intentional with preparing the physicians for the Open Notes implementation, but the implementation on the patient side might get dropped or maybe not paid attention to. So there may be more opportunity for advisory councils to be very active in those. And so we did have a call to action out of this work group to ask all patient family advisors within the PFAN to ask their organizations, do you have Open Notes? And if you do, how are patients and families using them? How many are using them? And it's been amazing to see, just asking the question has opened so many conversations and opportunities for us to have impact. The other interesting thing coming out about this is the difficulty in accessing Open Notes logistically through some of the EHRs. And so this group is actually putting together a communication to the primary EHR companies to let them know how important it is for us to have access, and that we would love to be a resource to them as they design more user-friendly methods. So great work going on in this group, wonderful collaboration with Open Notes. These groups, by the way, are all very open. If you're interested in joining, there is a contact form on the website under each of these work groups. The next work group is the qualitative work group, which we recently recognized as scaring the heck out of people when you say qualitative research. Most patient family advisors, are myself included, a little intimidated by that. But what we're really talking about is doing some interviews and gaining some narrative from patient family advisors directly about their discharge experiences. So what we're looking to do is collect that qualitative data. We have wonderful partners in Melinda Whetstone and Allison at Florida Hospital Association, who have taken painstaking patience with me to help me to understand qualitative research and how it works and what the outcomes could be and how we could use those outcomes. So what we're looking to do there is to develop a tool for hospitals to have interviews with their own patient populations to see what where the sticking points might be. So more to come there as well, but don't think about the qualitative, think about storytelling. And please think about joining us for that work group as well. So the final was to create a national advisor community. That was a high priority for the group at the Patient Family Advisor Summit. And our response to that has been, we initiated a work group, we did the environmental scan, and what the group decided was to really focus on expanding what we had already going with the Patient Family Advisor Network. So to do that, we did a couple of things. We hired Erica Steed, who has vast experience from the Augusta Health System in patient family advisory councils, to help us really devote her time to developing the PFA network. We started the website. We've worked to distinguish the PFAN network from PFCCparnters as an organization. Right now, our mailing list goes to 440 patient family advisors. I expect that number to continue to rise as we continue to support healthcare organizations to develop advisory councils using our gateway collaboratives. So every time we do a collaborative, we've got 8 to 10 new councils, 8 to 10 new advisors per council. There's a lot of growth going on right now, and so we do expect those members to those number of members to rise, as well as just sort of getting our awareness out there. The registry I mentioned, we have detailed information on 42 advisors. There's probably another 40 to maybe 50 advisors who I know and have known for many years, so I do have that background on them. But the registry is where we'll pull from when we get requests for particular advisors. So when I talked about that more targeted recruitment, we'll pull from the registry. So those that we have more information on will be looked to, obviously we'll know them better than we know the others. So the more that we can build out that registry, the more of the 440 that we can get to give us more detailed information on the survey, the broader this is going to go. And I expect we'll have some success in doing that. Today is one of the opportunities for us to really ask for that in a public way. So I thought it might be interesting for you all to kind of see some of the information that we're gathering. One of the things that we're asking the advisors that are in that registry is where they primarily working. And so I thought this, if we had done this slide a couple of years ago, I think it would have been much higher percentage in hospitals. But over the last 5 years, as you all know, these advisor efforts have expanded exponentially across healthcare settings, across to quality improvement organizations, to research teams. There could be 10 more categories, but we dump all of those in other. So anyway, interesting to see kind of where advisors have experience. So if we're getting a call from the TCPI folks who need advisors who are working in the ambulatory setting, we can quickly call up that 11% that we have that are working in the ambulatory setting and see who we've got to go over there. So it's working quite well for us. I have to give a shout out to Stephen Hoy, our Chief Operating Officer, for developing a database that is working for us extremely well to be able to manage these requests. Another thing that we're looking at is what kind of advisor work interests those who are responding. So we've got, I know it's a little bit hard to read, but are you interested in developing PFACs, or are you on a PFAC? Do you work in primarily patient safety, medication management, patient advocacy, patient experience work? Are you interested in speaking engagements? Do you feel comfortable doing webinar presentations? So these are the kinds of pieces of information we're collecting so that we can, again, make really good matches. I think there's 24 questions on the survey, so other things are, biographical data, contact information. One area that I was looking at last night in preparation for today is our racial breakdown, and our ethnic breakdown, I should say, and that's not comfortable. It's still very, very highly densely Caucasian, and we'd really like to be contributing to how we get this work, how we open this space more for our disparate populations. So that's certainly something that I would like us as a community to address and figure out. So that's another, we have a lovely distribution of ages. We've got young moms to a significant geriatric population that are really involved, and everyone in between. We ask for their patient experience primarily. So, we've got cancer patients, and we've got family caregivers, and we've got, we have that information as well. So a lot of really good detailed information on our advisors that allow us to make good connections for both the organizations that are requesting them and the advisors themselves, so they're doing the things they enjoy doing. So what are some of the benefits for advisors of joining the Patient Family Advisor Network? Peer support, number one. When I started on my first council in 1996, 5 or 6, I thought I was the only one in the world doing this. And that was so gratifying the first time I went to the Institute for Patient Family Centered Care conference. And I thought, oh my gosh, look at all these people that are also involved. We should be connecting. So the idea that you're not alone, and that the struggles your council is encountering may be typical and may have some good solutions, that peer support is really important. The ideas exchange is critical and creating spread of best practices around using advisors. The connection to the state, regional, national engagement opportunities to co-design the community. We as a patient and family caregiver community need to be active in our healthcare system and need to be active right now so that we are part of co-designing the solutions we're moving towards. It's really important. And also just building the future state for advisors. I know that's a passion of mine as, when I retire, that this work is really well defined and is moving forward and creating more and more space for more and more people. So what are some of the benefits for the healthcare organizations in tapping us for advisors for those larger regional, state, and national projects? That you get prepared advisors who have had these opportunities to increase their skills, that you have advisors who can bring back new ideas to your organization from that peer support, that you have advisors who are going to be knowledgeable of the context and complexity of healthcare. We hear that all the time from our organizations. We're doing great things with our advisors, but they just don't understand how hard it is to move and how many layers of this initiative has to get approved by before we can put it in action. And so by having these conversations, we're providing and supplementing that context. Advisors who understand what their role is and the responsibility they have to come as full partners to improve care. And then the healthcare organization's recognition that comes from their advisors getting involved in state and regional, national efforts. We always want our advisors to talk about their organizations that they're working with locally to raise that awareness and, again, increase the profile of the great work that each of your organizations is doing. So our call to action to all of you from all of us is for advisors to go to the website and sign up. Give us that detailed information if you want to be involved in further opportunities. If you don't, make sure you're on our on our listserv so that you can join us for virtual meetings. Not everybody's ready to take that next step. Not everybody has that time. We totally get that. Want to ensure that you have space. So either way, go on there and sign up, and we'll be sure to support you in your efforts. For the healthcare professionals on the call, provide your advisors with the opportunity to join the PFA network so that they can get more experience, context, and ideas. And fill out the online request if you're looking for experienced advisors for your project, your team, or your presenters panel, or whatever else you might have. So those are our calls to action. We hope that you'll join us in co-designing this community. I think that there's a real need for it. I know that there's a real need for it. And we certainly don't have all the answers. We are open to any and all who want to join us and really, again, co-design this community. So I'll stop talking, because that seemed like a lot. And we have a few minutes left if anybody has any questions or ideas, thoughts.
Libby, this is Joan.
Hi, Joan.
Hi. So do you have plans to, in what way, or do you envision yet a way to kind of connect people who are looking for help with a specific project? So if at John Muir we're working on the discharge process and we want to kind of find out best practices from other hospitals that have maybe done that project, of all the kind of ways that you're connecting everyone, which is fantastic, is there a way that you envision creating an easy way for us to hook up with someone that might be working on a similar project and have some good advice for us?
Great question, Joan. Yeah, because we're doing that informally right now, right? Just because we know folks, but as the numbers grow, that's not going to be possible. So putting some thought and effort into how we will capture that, and how we can link, I think I would love to continue to think about that with you and with anybody else who's interested. My first thought in that direction would be Smart Patients would be a great opportunity for that. So posting a question and saying, we're working on a readmissions project. Has anyone else worked on that? And getting that real-time feedback would probably be the most expedient way at this point, but I would certainly like to think with you about how else we might connect folks.
Great, thanks.
Sure. Any other questions? Anything in chat, Lindsay?
We do have one we've had a few that I've been answering throughout, just about getting the recording and taking the interest survey that can be done on the website. We do have one from Lisa Part, asking, how can I get connected with other similar advisory councils specific to mine?
So again, I think, Lisa, going to Smart Patients and writing up a description of your council and what you're sort of looking to connect with would be one way. Certainly calling Erica or calling myself, you know, from what we know of other councils, we'd be happy to do that matching as well. Well, Lindsay, I think we're almost right at time, so I guess I will turn it back to you to close us out.
Okay, that sounds good. Thank you everyone for joining our August workshop. I'll go back on video. Sorry, I was eating my lunch. And again, I put in the chat, but for those who are not on your computer, we will be sending out the recording next week to all of the participants, so you can review the slides and more information that you might have missed. So that will be sent out next week. Other than that, keep in mind that the PFA Network virtual meeting will be in the middle of September, and we have another workshop at the end of September as well. So if there aren't any other questions, thank you everyone, and thank you so much, Libby, for providing everyone more information about the network. I think it's been really helpful to help get the word out about how advisors and facilitators can get their advisors connected.
My pleasure. Thanks everybody for spending an hour with us. Have a good afternoon.
Thank you. And yes, also connect with Erica Steed if you have any questions about the PFA network. Her information is in the chat box. She is the PFA network coordinator. So connect with Erica also. All right. Thanks everyone. Have a good weekend.
Yay.
Thank you.